Are you having trouble remembering the key associations and findings of Guillain-Barré syndrome? Well, I got you covered. Guillain-Barré syndrome is a peripheral demyelinating condition. So, multiple sclerosis was a central demyelinating condition. Remember that Guillain-Barré syndrome is peripheral. Additionally, Guillain-Barré syndrome is associated with Campylobacter jejuni infection. So patients with Guillain-Barré will have had a history of diarrheal illness about 2 to 3 weeks prior to arrival. And now they're having ascending weakness that starts in their legs and works its way up. So remember that Guillain-Barré syndrome is actually associated with an ascending weakness. The complications you want to be thinking about with Guillain-Barré syndrome are bowel and bladder dysfunction and breathing difficulties. So remember that Guillain-Barré syndrome is an ascending weakness, right? So you start in your legs and you work your way up. Well, that can impact the bowel and bladder. You'll have autonomic symptoms, and you can also get respiratory difficulty when the diaphragm gets affected. So these are things that you want to keep in mind with Guillain-Barré syndrome, and you want to get them treated effectively. Remember that in patients with respiratory failure, you want to get them intubated immediately. Additionally, there are no curative treatments for Guillain-Barré syndrome, but you can give things such as plasmapheresis or IVIG in patients with acute exacerbations of GBS or to promote recovery in patients with ongoing Guillain-Barré syndrome. Remember that Guillain-Barré syndrome is ultimately a self-resolving condition, so you could also just leave it alone and it will get better with time.